Hello everyone, in this video we'll probably be covering one of the most used medications in hospital medicine, which is Tylenol or acetaminophen, and specifically when to use it in the context of fever. So acetaminophen can be used for fever, can be used for pain. We're going to focus on fever in this episode. So here the joke is, you might be allergic to Tylenol but not Percocet. Well, Percocet is just oxycodone plus Tylenol, so don't believe those drug-seeking patients when they ask you for it. Let's talk about Tylenol and fever, one of the most used drugs in hospital medicine nowadays, and when to use it, what does the data show? Now, just so we're on the same page, let's discuss fever. So fever has different thresholds depending on your institution. For some places it's 100 Fahrenheit, for others it's 100.4. 100.4 is the more common one that I've seen. And just to keep in mind, for elderly patients, their body temperatures are going to be lower than in younger people. So for them, I would use the 100 Fahrenheit threshold instead of the 100.4 as a reasonable indicator for fever. And when you think of a differential diagnosis for a fever, it's important to consider other things outside of infections. So you can consider heat stroke, malignant hyperthermia from medications, NMS, serotonin syndromes, drugs like MDMA, ecstasy, street drugs, lymphomas can cause this. Cyclic neutropenias, familial genetic conditions like Mediterranean fever can also cause fever. So make sure to keep your differential wide and make sure to understand the patient in a broader sense before you jump in on the diagnosis of infection and jump to the infectious workup. Now, why would we want to reduce fever with a drug like Tylenol? Well, first of all, if you have a younger patient with a more benign condition like a viral respiratory tract infection that's really not causing them to require oxygen, etc., reducing the fever would mainly be for their comfort. And in most cases, if you have a low-grade fever, which is below 104 Fahrenheit, then you wouldn't treat it if the person's not uncomfortable. If the person's temperature rises to 104, then you would treat it because the temperature is too high, and at that point, it's so high it's damaging your own cells. So it would be justifiable. The other thing is you want to treat fevers in patients that are more critical, like in the ICU, because fever actually increases oxygen demand and can exacerbate cardio and pulmonary insufficiencies. So for ICU patients, I would always treat a fever, and for more benign cases, you would take it case by case as long as the fever is below 104. A side note to notice here is that patients taking steroids or elderly patients, hypothermia or low temperatures can be your first sign of infection instead of fever. So just keep that in mind. So jumping into Tylenol or acetaminophen, this medication works by acting on the CNS by inhibiting the COX-2 enzyme. And by doing that, you reduce the levels of prostaglandin E in the brain that act on the hypothalamus, and therefore your body threshold temperature goes down. So how much do we expect Tylenol to reduce temperature by? Well, it can really vary quite significantly. It usually goes to about half to 1 degree Fahrenheit over an average of 6 hours after giving Tylenol. And the important thing to note here is that usually if you want to use Tylenol, you're going to use PO or per rectum Tylenol. I would avoid IV unless absolutely necessary because it's just so expensive and not worth the cost unless it's your last resort. And the thing that we really want to hammer home here, does Tylenol reduce hospital mortality in critically ill patients? That's important. And the HEAT trial was looking to identify this. And what they found was that it does not reduce hospital mortality in these critically ill patients, but it delays the date of death. So in general, the patients were found to leave the ICU a little bit earlier if they received Tylenol. So I would, as I said before, treat fevers in critically ill patients. It reduces the strain on their heart and their lungs, which are usually severely affected in these patients. And again, it shows that we're delaying death date, but not necessarily reducing mortality. Another alternative to Tylenol or acetaminophen is NSAIDs. Now, NSAIDs don't just block COX-2, they block COX-1 as well, and they stop the prostaglandin formation more systemically in the whole body. So they have anti-inflammatory effects. They also have antiplatelet effects, GI effects. So if we want to avoid further anticoagulating someone who's very prone to bleeding, we would use Tylenol instead of NSAIDs, right? And if we want to avoid any GI side effects in someone with ulcers, we would again use Tylenol instead of NSAIDs for both pain and fever management. But NSAIDs are equally effective, and if you don't have any problems with your platelets, your GI system, you could alternate Tylenol and NSAIDs, and it has been shown to be more effective in some cases. So for example, if you want to use Tylenol every 6 to 8 hours and ibuprofen every 8 to 12 hours, that regimen has also been shown to increase reduction in fever and pain in some patients. All right, so here's our summary of Tylenol use in fever. Our main point is you should use Tylenol in fevers in patients that are uncomfortable, have a body temperature of greater than 104 in more benign cases, or if they're critically ill, because it will help them get out of the ICU a little bit faster. You can combine Tylenol with NSAIDs unless you are avoiding antiplatelet effects or have GI effects that you're looking to reduce. Okay, so those are our take-home points. I hope this video was helpful, and I'll see you in the next one.